And welcome to Health is Wealth with Dr. Mike. Jim Lang for round two with Dr. Mike Carosa. Good morning, Dr. Mike. I hope everyone's having a good time. This is a busy, busy time. Just a reminder, Rob on the Road is at the Health Expo today, so look for him. Rob on the Road doing his thing, but lots going on, Dr. Mike.
Yes, Jim. And thank you for coming on the show again, Jim. It was really amazing to have you last week and now this week again. And I appreciate this segment on sports rehabilitation and sports medicine. I think, we have a lot to talk about. And of course, you're with your background and expertise in sort of sports analyst and, you got a lot to, in being an athlete yourself. I mean, there's a lot for us to talk about.
Well, there is a lot to talk about. Unfortunately, I'm still sort of a wannabe athlete and performing and trying to play out there. And concussions is the big story, not just professional athletes, but weekend warriors and my kids seeing some of their friends deal with concussions. Let's talk about concussions, and which can happen in almost any sport right now.
Yeah, and this is a big topic right now. This is not only just the pro athletes. This is our youngsters. This is our kids. This is the growing individuals that actually don't end up making it to pro sports because they get some TBIs, which is traumatic brain injury. So some kind of brain injury will debilitate an individual and bring them to that level in terms of, them not being able to play. We've seen it in pro hockey. Mm-hmm. We know some major hockey players who actually couldn't play anymore because
Eric Lindros, number one.
He's a big one. Yeah, he had like 4 or 5 concussions
that we know of.
Yeah. Well, that's the whole other side of the spectrum, right, Jim? I mean, the idea is a lot of players are playing through, right? There's a lot of stress. You got to feed the family. You want to play up in the big leagues. You don't want to talk about your sort of injury, and you'll play through it.
Now, one thing they've done in Ontario is Rowan's Law because of a young female high school rugby player who died from multiple concussions. And now anywhere you go on high school athletics, in amateur rinks, it's the stop, sit, and report. So, hey, I've been hit. Stop playing. Get off the field. Get off the ice. Talk to someone and sit down and take care of it. Don't keep playing through it.
Yeah, no, and let's face it, 10% of all contact sport athletes experience a concussion. That's 10% of all people playing. That's a huge number. Now, if you break it down, you talk about in terms of, we can even talk about in terms of fatalities. Obviously football being the number one in terms of fatalities, 95% of head injuries are related to fatalities. So, it could actually cause detriment and even death.
And we're even seeing in the elite levels of soccer, that ball is screaming it at such a high velocity. When they're heading the ball in, they're getting little mild mini concussions, and it starts to add up.
Absolutely. And, the idea is you don't have to just smack your head against the boards. You don't have to smack your head against a hard object. And yes, a ball is hard and you could be heading it. I think one of the really interesting stats is, soccer's up there with injuries in terms of concussions as well. So you have soccer. So how the hierarchy is predominantly is you have cycling. Cycling's a big where you have some concussions, obviously a big number.
From accidents, from falling off the bike?
Correct. About 40,000. Annually, huge. Once it starts coming down, obviously football is right up there, and so is hockey, but then soccer, right? Because it's that unprotected. So what's really good, and you want to prevent and prevention, we're going to talk about prevention, we'll talk about a lot of things about prevention, but you definitely want to keep things like your helmet on. But in a sport like soccer, because you brought it up, I think it's important, you don't have a helmet.
You have nothing.
And it's yet to be determined whether this is something that is going to be necessary moving forward. But yeah, you're right. That high velocity ball striking at you when you don't think and you can't even think twice. It's going to, it's not about just hitting your head. It's about, allowing it's your brain in the skull actually shaking and vibrating, and it depends, and it's getting bruised. And if that gets bruised, that's a TBI.
I think more than anything, the majority of people don't really understand what is a concussion. How do I know if my child has a concussion or I have a concussion? What are the signs saying, wait, I better see a medical specialist because I think I have a problem?
So temporary loss of consciousness is probably a big one. Nausea, vomiting is also huge. In terms of a doctor going into an ER, you want to look at the patient to make sure the papillary reflex, so you look at their pupils, make sure they're equally opening at the same time. But any kind of loss of consciousness, ringing in the ears, even as little as that. Obviously, a child will say, hey, I saw stars. That's actually a big red flag. And all TBIs, traumatic brain injuries, should be taken seriously. So you can't just, hey, let's put my son in a room now and just leave him in a dark room, let him go to sleep like they previously thought. This is no longer the case. We need to take action with these kids now.
And I know from reading some stories and doing research on my own, from hearing the stories, you get one concussion. The next hit to get the second one doesn't have to be as hard as the first one. Is that correct?
Correct, because probably most definitely you didn't recover from the first one properly to begin with, and we know that. I mean, we can even talk to the point about, and I think that some pro athletes can discuss. And we're going to have somebody on our show, Dr. Ryan Sachitano. He's going to come in and talk about in terms of things. Dr. Ryan's going to speak about his personal injuries and what he's seen, and how that will actually take somebody out of a sport. Because being a pro athlete, and now of course he's a doctor, he wrote a book, we're going to have him on, we're going to talk about things like diet, nutrition, what else we can do to prevent. But most importantly, I think what we can discuss in today's show is about awareness. It's about awareness that, and I'll just tell you a story, Jim. Last weekend I had my son on the icy 6, and he smacked his head pretty hard against the boards. Pretty hard that, I looked at it and I'm just like, I hope he gets up. And we see this, right, Jem? We see this in sports, because it really, when we see these athletes go down, we're not related to these athletes, but can you imagine what the family is seeing when they see a guy go down and he's really not moving? And then when he puts his thumb up or he says something to say, hey, I'm okay. Right, it's a little bit reassuring, but it's scary when you see these athletes go down. When you get a big check against the boards and that athlete's not getting back up, or it's a head-to-head injury. But in terms of my son, so my wife ran down. By the time she ran down, my son got up, and he knows I was watching him from the window above, and he looked at me and he gave me the thumbs up. He's like, "Dad, I'm good." But there's some things to talk about regarding that injury. What do we do? Oh, do we put him in a room? Do we let him just tell? We asked him if he was okay. I looked at him. I assessed him. He was fine. It was a hard hit. And I'm going to be honest with you, Jim. I mean, if it was another child, I'm not sure if that child, because it depends on the individual. And we're going to talk about that in terms of nutrition and diet. It depends on the individual in terms of what that individual can actually is predisposed to.
Isn't it true that the especially male teenagers, are more susceptible to concussions from contact injuries than, say, a kid 6 or 7 or a female of the same age?
Actually, it's a little bit...
Because I've heard stories about that.
Yeah, no, you're right. But unfortunately, the latest stat actually shows that women are more susceptible to TBIs. And actually, the concussion rates are actually highest in female soccer players.
Really?
So there's something to be said about the infrastructure in terms of the brain of young females. I mean, you can look at some of the research, but it starts early, and you want to protect your kids. I mean, so what they're doing now, and I think we'll talk about this in our next section, is we have to take a stance. Like, there's things that we have to do because society has changed, and we have to reinforce things like the building block. The building block of our brain has to get changed. We need to fuel the cells that are necessary. So we're going to talk about some things in terms of diet and what types of diets are extremely important and how we can facilitate the brain to be preventative in terms of protective. So my son got a brain injury. Potentially, like, he got hit in the boards. I mean, Jim, if you would have saw it, like, everybody said, "Oh, wow!" Like, just you heard it in the crowd. I mean, it's, but I mean, if that was another kid and he wasn't on the diet that he was on, I'm pretty sure that it would have been a different event.
When we come back, how diet can help and hurt sport injuries. This is Health is Wealth on 105.9 The Region. Stay with us. We'll be right back. You're listening to 105.9 The Region, and welcome back to Health is Wealth. I'm with Dr. Mike. I'm Jim Lang with my co-host today, of course, Dr. Mike Carosa. We continue our conversation about sports injuries, and this is something that I've heard a lot about. I'm dying to hear your input. How diet can help prevent or at least cut down the severity of your sports injury.
Okay, so first, let's look at the infrastructure. We have to look at the brain itself. We're going to talk about concussions because I think that's predominantly, right, Jim? You can agree. I mean, that's predominantly the number one injury that gets sustained, and we're seeing it more and more. Actually, it's becoming more common. What's really good is, athletic institutions are actually taking this serious today, right?
Well, they had to, and they actually had to retrain the minor hockey coach, the high school volleyball coach. You name the sport, they had to actually properly train them to identify and say, get that kid off the playing field.
That's it. And so, get them off the playing field, lie them down. That's not good. I mean, get them off the playing field, obviously get away from the contact again and take them out for a duration to get them assessed is key. But you want to keep them active. You still want to keep them active. You still want to get their brain, because the research shows that staving these people off sort of any kind of activity is actually more harmful than good. So that's number one. So like just sitting in a dark room or going inside, that's something that you don't want to do. But let's look at the infrastructure. Let's look at the brain itself. The brain itself is a big fatty acid membrane predominantly. It's built up of fats. So 40% of our brain is built up of fats. I don't know if you knew that, Jim.
I did not.
So 40% of the brain is comprised predominantly of DHA. And DHA is docosahexaenoic acid. Now you can get that from fish. And I know you like to eat fish.
That's why they call that brain food, right?
Correct.
Oh.
Correct. And obviously, the big notion of eating fish will make you smart. And there is some research to that as well. But predominantly DHA, let's look at the fish itself. The fish gets that from the plankton, the phytoplankton that they eat, so the algae, right? Because that's predominantly, so you can get algal sources of DHA. So that fish is actually going to go out there and it's going to produce DHA and EPA. But let's talk about the brain itself. 40% of our brain, Jim, is comprised of DHA. So that's the infrastructure. Now, Dr. Lewis, who's a concussion expert, and he's well known, he created an analogy and he spoke to this point and he made a reference of, the brick and mortar of our brain is DHA, the brick and mortar. So, Jim, if you could envision, if you had a brick wall break down on, let's say, your house, and it would somehow get deteriorated, what would you do? What would you use to build that wall back up? Probably.
Well, if it was, I would use like the cement and the concrete to put bricks back up to rebuild it.
But you would use the same brick, right, Jim?
I would hope.
Exactly. And that's the key. Because if our brain is predominantly DHA, and we want to rehabilitate our brain from an injury, we want to make sure we put that DHA back in.
Right, okay.
And that's the analogy, is because, the whole infrastructure of our brain gets deteriorated as a result of an injury such as this. So 2 things that have been well documented and well researched. First of all, DHA, docosahexaenoic acid. That's the omega-3 fatty acid from fish, but actually can be from a vegetarian source. For our listeners out there, you don't have to just rely on the fish oil. That's number 1. Now, number 2, if you look at the research, first of all, having a diet rich in things like DHA initially will not only prevent and help the healing process early on from a concussion. But secondary, when you take it as a result of having concussion, it will actually heal faster and you can recover much quickly. So, I'll give you my take in terms of what I think every single youngster needs to consume. But an omega-6 score test will tell you your omega-6 to omega-3 ratio, Jim. And I'll have you do it one day. I can bring in a kit. Sure. It's really easy, just a finger prick.
Okay.
And we mail it off. Anyways, we'll get your omega-6 to omega-3 ratio. And if your ratio is in favor of omega-6, you're more pro-inflammatory.
Okay.
So if it's in favor of omega-3, which I've never seen in practice in certain individuals, and obviously once we're working with individuals and these athletes, this is where you want to see them. So ideally, things like DHA is something that's extremely important, and they're actually putting in this in the infant formula. I don't know if you knew that, Jim, but they're actually giving DHA. So DHA is very important for the infant development phase.
Brain development, et cetera.
Correct.
Yeah.
And you got to keep that going. You have to keep that going. So early in life, it's necessary, and thereon after. So, for all our listeners out there, if you got a kid in any kind of contact sport, soccer, hockey, football, even basketball, by the way, could have an injury. You want to put your kid on a fish oil. And if they're intolerant to fish, they can't have fish. Guess what? There's an algae source that will still give you the DHA, which is what the fish eat. So you'll be okay. And it's that idea of getting the cell membranes more anti-inflammatory, but it's not just inflammation. It's more getting the cells the structure they need to actually form the neurological development.
But is there a plant, vegetable, or fruit other than fish that would do you any good?
Well, we got some turmeric shots here today from Nature's Emporium. I brought them in for you, Jim.
Oh.
Now you just shake it up. Really, really amazing. I mean, it's obviously very pungent, right? Because I don't know if you've had a turmeric or ginger shot, the same idea.
Yeah, it is strong.
So this is one thing that you can take, and we brought some other guests on the show to talk about like turmeric and actually taking a high doses of this. But this is like a cold pressed juice, real fresh, 100% organic, and you take it, and you're going to get that anti-inflammatory effect. So something like turmeric would actually help concussions.
Okay.
And also things
after the fact.
Well, before or after,
okay.
But for sure after, because we want to have that anti-inflammatory. Listen, you have that concussion, the cells are being inflamed. What can we do? And you bring in something like turmeric, and it'll become that anti-inflammatory like effect. And this is something that you can get at your local Nature's Emporium for sure.
What about like nuts or grapes or anything like that? How would they help you?
Okay, so the resveratrol, which is from the skin of grapes, is an antioxidant that is responsible, and actually there's a lot of data on this to actually help recovery from things like concussions, and at the same time will help the brain cells.
No kidding.
Yeah.
I did not know that. Okay,
so that glass of wine you have at night, the red wine, of course, not the white wine, will actually help you a little bit along the way.
My wife likes her white wine. So when we come back, we meet the author of A Bud to Behold. I'm not kidding. Stick around. We'll explain. This is Health is Wealth with Dr. Mike on 105.9 The Region. You're listening to 105.9 The Region. Welcome back to Health is Wealth with Dr. Mike. I'm Jim Lang, sitting in for Tina Cortez. My co-host is Dr. Mike Carosa. Mike, we've got a special guest today, don't we?
We do, Jim. I'm really excited. So not only do we have yourself here, which is really amazing, but we have Dr. Ryan Shakitano. He's here. He's in the house. Dr. Ryan, thank you for coming on the show.
Amazing. Thank you guys for having me.
Well, I mean, he's not just a guest. He's an author of a book, A Bud to Behold. And this is not sort of an homage to J-Lo and all the great superstar women of Hollywood and music. This is about the importance of your pelvis, of your glutes, your core, basically the foundation of your body.
Absolutely.
100%.
Yeah.
Because I think so many people, because I still work out, I see them in the gym, they do some curls, a little bench, and from like mid-chest down, they do nothing.
Yeah. Zero attention given to that lower body. It's insane.
And it's like trying to put a house on little 2x4s and hope it's going to stay. It'll never hold up.
Yeah, 100%.
So why do people not worry about their core, their glutes, and their thighs to make sure their physical foundation is strong?
It's not part of that beach body, Jim.
Okay.
They need to. They 100% need to. And the sort of idea behind the book, or why I wrote the book, was in part because of my sports background, which we'll touch on, I'm sure. But the more I saw in my clinical practice different injuries of the lower body or even the low back, the more I could take a step back and say, okay, let's look at what's causing this injury or some of the predisposing factors that led to the straw that broke the camel's back. And invariably, I would find stuff around the hips and the glutes.
Because the reason I'm so passionate about this, I'd say about 18, 19 years ago, I had a pretty bad sciatic injury.
Right.
And then through physical therapy and that, I realized from about a gut down, my foundation was horrible. Right. So I had to change everything because I was a typical 80s, 90s gym guy. Right. And as a result, my body tried to compensate, and then my sciatic went, and I was in pain, and I had to fix that to prevent it.
Right, exactly. And oftentimes people take that injury in isolation and just treat that sciatica, but it sounds like you took the step back and said, okay, what's causing this, and let's address that, which is awesome.
Yeah.
And I love that Dr. Ryan brings that, that presence, because at the end of the day, we're both naturopathic doctors, and we're going to talk about how you became a naturopathic doctor, true inspiration, actually. But most importantly, finding the root cause, right, Dr. Ryan? That's the key. All of our listeners out there, we always speak to point of this. We always discuss this. We have to find the root cause of many issues. And I think he knocked it out of the park by not only, producing and writing the book, but the pelvic girdle is predominantly responsible in a lot of the issues that arise, even including knee and back and low back pain, right, Dr. Ryan?
Yeah, 100%. I'll give you an example, a clinical example. So I had a teenage soccer player come in to see me with a medial meniscus tear, what I thought was a medial meniscus tear. So I assessed him. I said, this is probably what's going on. I'll treat your medial meniscus for sure, but let's take a step back and say, okay, what predisposing factors led to that medial meniscus having that extra stress put on it. And it turns out his hip internal rotation, or one of the rotations at his hip, was very, very limited. So I treat his knee, but I also say, okay, let's treat that as well. So when you come back to playing, not only are you at sort of a better stage you were before, but you're also at less risk of re-injury.
And Ryan, I hear from so many pro athletes, people don't realize this, the NHL, NBA, they're always compensating physically, sometimes without realizing it. And the trainers, that's why they're putting in so many long hours, because they realize it's not just your shoulder. It's not just your back or your knee. There's something else in your body that we have to go all the way back to the beginning of the map to find it.
Right, yeah. And when I was playing soccer, so that's part of the reason sort of behind the book as well, I was training for an upcoming season when I was playing at the University of Toronto, and I was hitting 50, 60-yard passes repeatedly, because that was part of my job as a player. And my pelvis and hips ended up sort of shifting. And I was misdiagnosed with a herniated disc because of the symptoms I was experiencing, like that tingling down the legs, the numbness, the severe low back pain. Turns out it was never my disc at all. It was all around the pelvis, all around those hips.
But you were that out of alignment.
I was that out of alignment, yeah, unfortunately.
And how long did it take to get it back into alignment?
Once I knew what the problem was, within a few weeks.
Oh, okay.
But I dealt with this for years.
Finding the root cause, right, Jim? That's the idea. And I think that's an amazing story. I want to touch on that right now. I think it's important. So here's the story, and Jim, we have kids, and we tell our kids, who are who potentially want to become pro athletes, and say, hey, look, you know what? Let's get an education just in case, so it doesn't work out. Maybe you get injured, right, Jim? I mean, you want to make sure you have that education. Dr. Ryan is that example. So here's a pro athlete, and as a result of having several injuries, right, Dr. Ryan? I mean, I think you had a few. Mm-hmm. I mean, he became a naturopathic doctor. And what I want to talk about is, first of all, kudos to you, because, it's opening up a whole different, style of practice where I think you can actually, be one with the actual individual and the athlete, because you've been there, right?
Right.
So tell us about your story.
Yeah. So I was heavy into soccer.
Well, you made it pro, right? I mean,
I was with Toronto FC, yes, at the age of 20, absolutely. So I was at the University of Toronto at the age of 18. I started there. Mm-hmm. And I always knew I wanted to give soccer a shot, but I knew I wanted to be a doctor. Whether that happened when I was 25, 35, 45, whatever it was. Once my soccer career was done, I wanted to be a doctor.
Amazing.
Yeah, so going into my third year U of T, as we were talking about, I got injured pretty severely because of that pelvic issue. On top of that, I had suffered a few concussions along the way.
From heading the ball?
I took an elbow to the head.
Okay.
Yeah, and the previous one was an elbow to the side of the head. So it's been a road.
And it happens at that level of soccer.
Well, we mentioned that. We just mentioned that, Dr. Ryan, of course, and soccer being a sport that not a lot of people think that concussions actually, it's prevalent.
Hey, basketball, you're in the key. Those are big men. And accidents happen, and you can get really banged around.
Oh, yeah, elbows are flying for sure in there.
Absolutely, yeah.
Definitely. So I had finished off that third year at the University of Toronto. I'd battled through that injury with the low back pain. I'd suffered a few concussions in the past, and I was questioning at that time. It's like, okay, I know I want to be a doctor. Can I risk continuing to play, taking another shot to the head or whatever damage I'm doing to the low back, keeping in mind my ultimate goal is to one day be able to take care of people. So I decided after resting that off season, I was like, you know what, let's keep going. Let's give this a shot. Ended up having an exhibition game against one of the academy teams at Toronto FC, who was coached at the time by Danny Dicchio. And he's awesome guy, awesome coach. Shout out to Danny Dicchio. He ended up inviting me in for a tryout a few weeks later and made his team. But a week before the season started, I ended up having a relapse in the symptoms in the low back. So again, numbness, tingling, you name it. I go and see one of the practitioners there who's an athletic therapist, becoming a naturopath. And he sort of does that what we talked about before, takes a step back and says, okay, what could be causing some of these symptoms? He goes, I'm 80 to 90% sure it's not your disc. And I was like in shock. I'm like, here I am thinking I relapsed and had another issue with my disc, and ends up being, like we were talking about, issues with the pelvis. So he gets me back playing within about a week or so, and I end up making my pro debut a few months later.
And I think it was Liverpool, right?
It was against Liverpool in July 2012.
No kidding.
Yeah.
Well, now what a way. I mean, you can always say you played mighty Liverpool. That's nothing wrong with that, dog.
Exactly, yeah.
The exercises in the book, A Bud to Behold, they're not intimidating.
Right.
Anyone, no matter what age, can do. They're all simple body weight exercises designed for you to get the most out of your core and your butt. And obviously, you must have written that and performed that with getting as many average people in mind to be aware of how important this is.
Exactly. And that's sort of my goal, right? It doesn't matter if you're a 25-year-old pro athlete or a 75-year-old with osteoarthritis in their knee. I want you to be able to be as active as you can be. And a lot of it, like we've been talking about, goes back to the hips and the glutes. So I definitely had that in mind when I was putting together that program.
And I must think, we sit so much now that is something like this, even how many minutes a day could make a big difference.
That's a 30-minute-a-day program.
Wow.
Yeah.
And the thing I love about this show is what both of you gentlemen bring to the table is an athlete, even Sidney Crosby, when he broke in the NHL at 05-06 season, what he eats and how he trains 15 years later is completely different because the evolution is nonstop. The people saying, maybe you need to incorporate this exercise for your core. Maybe you need to incorporate this for your diet because he did have a concussion problem at one time in his life. More fish, less beef, and that's never stops.
Yeah, exactly. And you look at all other major athletes, one of which is quite important, is Tom Brady.
Well, I mean, he's in his mid-40s, still playing elite-level NFL because he's 100% committed to naturopathic diet and exercise every day. Every day.
Yeah.
Every day.
And it pains me as a Dolphins fan.
I know. I'm a Raiders fan. It kills me. But he lives it. He walks the walk. He doesn't just say stuff. I mean, he actually lives the plant-based naturopathic life, and the proof is he's still in his 40s playing as well as anybody in the NFL.
Yeah, and I think that's the key. I think the key is, you got to piece this all together. It's not just, conditioning yourself in the gym and doing some of these great exercises. You got to eat right to feel great. And let food be thy medicine and medicine be thy food. I think that's pretty much how we take this. And that's the approach, Jem. I mean, and that whole, we talked about, one of the games in the NFL this past weekend was a huge concussion. A player walked off the field, had blood coming out of his ears and he was just down. And we're just like, you're just praying for the guy. And you're just like, so more and more pro athletes are adopting to this model. This plant-based
They have no
model.
choice. They have no choice. The book is called A Butt to Behold. A great butt has the power to change your life. Truer words were never spoken. Dr. Mike, if our listeners want to connect with you or Dr. Ryan at AppleMed Clinic, how can they do that?
So first off, I'd like to welcome Dr. Ryan to our family. And in terms of the AppleMed Center, you can reach us at 3560 Rutherford Road. We're Unit 45. AppleMed.ca is our website. 905-417-4000. You can reach us. And of course, AppleMed Clinic on IGTV, and you heard it first on AppleMed TV right now, and we're doing this wonderful interview with both Jim, and thank you, Jim, for coming on and
I learned a lot today.
And thank you, Dr. Ryan, for coming on and bringing a copy of your book, and we look forward to getting some patients healthy. We really do.
But that's what it's all about. That's our show for this week. If you missed any part of Health is Wealth, go to the website, 1059theregion.com. I'm Jim Lang. Thanks for listening. Be healthy. Check out Dr. Mike and Health is Wealth every week on 1059 The Region. We'll see you soon.